So ano-ano nga ba ang mga constitutional basis ng health and wellness program para sa mga senior citizens dito sa Pilipinas? Una, nakasaad sa Article 15, Section 4 that it is the duty of the family members to take care of the elderly while the state may design social security programs for them. Sinasabi rin sa Article 15, Section 10 that the state shall provide social justice in all phases of national development. At sinasabi din sa Article 8, Section 11 that the state shall adopt an integrated and comprehensive approach to health and other social services available to all the people at affordable cost. There shall be priority for the needs of the underprivileged, sick, elderly, disabled, women, and children. Ano-ano naman ang mga batas na nagpo-promote ng health and wellness ng senior citizens dito sa Pilipinas? Una dyan ang Republic Act 7432 or ang Senior Citizens Act of 1991. It is an act to maximize the contribution of senior citizens in nation building, grant benefits, and for special privileges and for other purposes. Meron din tayong Republic Act 9257 which is the Expanded Senior Citizens Act of 2003. And one of its additional declared policies is to give full support to the improvement of total well-being of the elderly and their full participation in the society, considering that they are an integral part of the Philippine society. Noong 2010, ang batas na ito ay naging RA 9994 o Expanded Senior Citizens Act of 2010, kung saan ang mga senior citizens ay binigyan ng 20% discount at exemption from VAT on the sale of medicines, influenza and pneumococcal vaccines, other essential medical accessories, supplies, and equipments. Meron din discount sa mga professional fees ng attending physicians sa mga private health institutions, professional fees of licensed healthcare professionals providing home healthcare services, medical and dental services, lab fees in private health institutions, funeral and burial services for the death of the senior citizens, pati pamasahe sa land transportation, domestic air travels, and sea shipping vessels. May discount din sa hotel, restaurants, amusement parks, at mga sinehan. Meron din tayong government assistance for the health of the senior citizens. There should be a national health program to provide an integrated health service for all senior citizens. Isinasaad dito na kailangang mayroong senior citizens ward in every government hospital. Ayon din sa RA 10642, kailangan ng mandatory PhilHealth for all senior citizens. This is an act granting mandatory National Health Insurance Program of PhilHealth for all senior citizens. Kailangan lang na ikaw ay Filipino citizen at resident ng Pilipinas, age 60 years and above, and are currently not covered by any membership category of PhilHealth. Qualified din ang mga dependents ng mga senior citizens who are also senior citizens themselves. Maliban sa mga nabanggit, meron pang ibang mga batas na nagsusupport sa ating mga senior citizens. Isa na dito ang Republic Act 10963 o ang Tax Reform for Acceleration and Inclusion Law o ang tinatawag nating TRAIN Law. Sa batas na ito, ang mga senior citizens ay may VAT exemptions para sa mga gamot sa mga diabetes, high cholesterol at hypertension. Dahil ito ang tatlo sa pinaka-common na diseases sa ating mga senior citizens. Meron din tayong RA 11350 o ang National Commission for Senior Citizens. This ensures the full implementation of laws, policies, and programs of the government pertaining to the senior citizens. Meron din tayong Republic Act No. 11223 o ang Universal Healthcare Law of 2019. Wherein it guarantees equitable access to affordable healthcare services for all Filipinos, including senior citizens. Ngayon naman ay tatalakayin natin ang Department of Health Program for the Health and Wellness of Senior Citizens. Ito ang 2015 DOH Administrative Order o ang National Policy on the Health and Wellness Program for the Senior Citizens. And last 2018, this program was renamed as Healthy and Productive Aging. The vision of this DOH program is a country where all Filipino senior citizens are able to live an improved quality of life through healthy and productive aging. The mission is to implement a well-designed program that shall promote the health and wellness of the senior citizens and improve their quality of life, in partnership with other stakeholders and sectors. Its goals and objectives include focused service delivery packages and integrated continuum of quality care in various settings. It also aims to be patient-centered and ensure safety and accessibility of all health facilities for the senior citizens. It also aims to have an equitable health financing, enhance capacity of other health providers and stakeholders in the implementation of health programs for the senior citizens. It also aims to have a database management system and conduct researches on the development and evidence-based policies for senior citizens. And lastly, it aims to have a strengthened coordination and collaboration among stakeholders involved in the implementation of programs for the senior citizens. Its strategies and action points include participatory governance for health through the life course, strengthened service delivery, advocacy and promotion of healthy aging, and evidence-based decision-making. Its program components include policy, standards and regulation, health financing, service delivery, human resources for health, health information, and governance for health. This DOH program has different partner institutions. Isa na rito ang Department of Geriatric Services of Jose Reyes Memorial Medical Center. Kasama din dyan ang Institute of Aging of the UP Manila, Philippine College of Geriatric Medicine, Philippine Health Insurance Corporation, Department of Social Welfare and Development, Coalition of Services of the Elderly, and Association of DOH Retired Employees. Some of its accomplishments include the provision of flu and pneumococcal vaccines, the wellness camp for the senior citizens, and the establishment of the Elderly Filipino Week, which is celebrated on the first week of October. Now, what are the different health promotion strategies for the senior citizens? This includes high protein intake, calcium plus vitamin D supplementation, regular physical activity, fall prevention program, and care for frail older persons. Various immunizations are also recommended, such as the PCV13, herpes zoster vaccination, influenza vaccination, Tdap vaccination, and in these times of COVID-19 pandemic, COVID-19 vaccination. Health screening strategies are also recommended, such as the vision screening, hearing screening, cognitive and depression screening, osteoporosis, and cancer screening.